look to the right. Is that it? Look to the left. Better to the left, eh? Now, is that upper or lower, or both? It's both, right? Because we're not isolating, okay? But it looks like you got market, better range of motion to the left, right? You can almost go over your track there. You okay with your glasses on? Okay, so now we're gonna go right chin to chest, all the way down.
Uh-oh, broken.
So you turn and I'll turn you. Is that about it?
Yeah.
Okay, so we kind of visualize how far that is, okay? And then we'll go the other way.
Oh, yeah.
Right, it looks like there is quite a restriction there.
Too much ice cream. Like I usually do, say my patients. Too much ice cream.
Too much ice cream, is that what you said? Oh my God, that's funny. Okay, and then if I palpate the lateral spinous processes on the neck, you may or may not be able to tell if it's rotated or not. But what I can tell with my fingers when I come on there, that they tend to point like that. Now bump just underneath the mastoid. If you find that mastoid, go up underneath it in the front, pinch in the back, you'll be on C1, right?
Sorry, Mike.
And you can see.
What's the history? What's the background?
We haven't taken any history. That's,
Okay.
so we can ask, you can say,
Too much ice cream.
so go tell us your history.
Multiple car accidents, kickboxing, wrestling. What else? Lots of ice hockey injuries. It's like going head first in the boards a few times.
You just got multiple
Why would you do
impacts on the neck.
And then been knocked out more than a few times kickboxing too. So like hyper-rotation.
When was the last one?
I can't really remember.
Okay, well, that's good enough.
Beauty
Start
of-
the line face up for me.
Beauty of concussions.
Can I steal your chair?
Of course, I put it there for you.
You're keeping me warm for me, right?
Yeah.
Thank you so much.
My pleasure.
Okay, so I'm going to show you ways to treat this. So slide back towards me. So if we go to full flexion like we did before, and then we rotate, see left is pretty good, right? Now I'm cheating a little bit. Man, I can use my sternum, right? But if you use your sternum, usually your boobies are over here anyways. That's not going on YouTube. Your boobies. Yeah. That's how we have fun in here.
It will be
right?
bonus.
Okay, yeah. So I've got him rotated or in the position where he's not going to go any further, right? Okay. Put my two fingers on the temple. You look towards the temple side and just ever so slightly push into my fingers. Okay. 4, 3, 2, 1. Relax. Look this way, and we just take up the slack. Okay.
Your hand is supporting occipital.
Yeah, occiput. Just supporting it. We want maintain that full flexion. Okay. And repeat and rinse. Right.
So he's rotating into you right now?
Yep.
With his eyeballs.
With the eyeballs and just a little extra.
Oh, okay.
Okay, and then look this way. You see just the look. Now I cheated a little bit. My hand is now also cupping C1, right? So I've kind of got C1, and I'm just encouraging that rotation to make sure he's gone all the way into that rotation. Okay, and repeat.
So with your thumb on the underhand, is it on the anterior surface? Or do you
Nope.
take rigid as that?
Side, lateral processes. Oh, you're doing pretty good.
Now you're just hanging out, letting us.
Yeah. Getting used to the new position. And we just keep repeating until we get no more gains. Okay. pressure. So possibly with MET, the object is that we're shifting the bone, right? Shifting the joint.
Just to check in, there's no like muscle cramping that you're
You
experiencing.
doing okay?
right?
Okay? Good, thumbs up. Yeah, anything that's, not good, you stop. No pressure. I'll show you first the way to do it and then the way not to do it. Because a lot of you are going to make a learner kind of error, which I want to eliminate first, okay? So he is now finished because by going any further, this shoulder just starts to come up,
Yeah.
which means it's lower cervical moving, not upper cervical anymore, right? Did you see that?
Yeah.
Watch, push here. Okay, and then look this way and turn. See how that's starting to come up? You're done. That's compensatory, right? So I just slowly bring it back to neutral and down. And then get to chill. Okay.
Fit your boobies back in place. Yeah.
Man movies?
But you're gonna do it bilaterally, right?
No,
Just the one side?
yeah, because it is only restricted to the one.
Oh, fair, okay.
And MET is to shift the bone, so we don't want to shift it back again.
Right, yeah,
Right?
okay, yeah.
Okay. Okay, so now what do we do? What's good therapists do right after? Just reassess, right? So I'm gonna go back into the full flexion. And then we're gonna turn,
Oh yeah.
right?
Feels nice.
What do you think?
Very cool.
Okay, and then back to neutral, and then down. Very simple technique, right? Eyes controlling upper cervical, which controls a lot of the spine, because your whole spine follows your eyes, and your head, and your body, right? So if you got a rotation of C1, you're kind of getting the signal to do this. And so your body's getting into that position. Is that going to cause problems in your rectus spinae eventually and joints down your back? Maybe. Okay, it goes right down. Your body is controlled by what's happening with your eyes. Okay, simple? Pretty simple, right? Easy to do. You don't have to worry about doing, I'm just adding a little pressure on C1, but you don't have to do that. It should shift if you got the right positioning. Okay, I'm going to do it again. You're going to tell me what I'm doing wrong.
Like, would it be good after this, just a little bit extra traction?
Yeah, you can do traction. Traction's always good.
Yeah.
Okay, so let's see. I'm going to go out of my position. I did my assessment. I found the restriction. Getting up to my flexion. Full flexion, see, like that. Turning here.
You're pushing the head into
Oh,
the.
yeah, right, look, I went from this neutral, like, inline, axial. A lot of people do that, okay?
And side flexion. Yeah.
It's just natural to do, because as you turn, your body goes over, and then you start side bending, right? So try to avoid that. Second one. Do better this time. Okay, I turn his head on axis. Okay, look this way. Look this way and push this way.
Is he supposed to be looking to the left?
Yes, exactly.
Oh.
You caught the error.
Okay.
People are looking the wrong way,
Okay.
right? So far so good, right?
You're looking in the direction that you're rotating.
Yeah.
That they're
That
rotating.
they're contracting into.
Yeah.
Oh, you're looking in the direction they're contracting into.
Yeah, so you're looking this way.
Yes.
When you're contracting, you're resisting that,
Okay, yep.
okay? And then you look in the direction that you want to turn the head. So passively, you're looking to the same side, contraction-wise, you're looking to the opposite side,
Contract, relax, stretching.
basically, yeah. Okay, next one. Okay, a little pressure, look towards my fingers.
Okay, you gotta go a little bit too.
And then relax, relax.
Why is your hand over
Question.
Definitely, a lot of people will do this. This is the most common mistake. Is you're so focused on rotating, you let it slide down a little bit, right? Now you've disengaged the posterior ligamentous system, and you're no longer isolating that joint. Right? And so all the other stuff, the tractions are good. And we'll just do one more, okay? And what's the one at the top that does the?
Longest collar?
Yep, the muscles up there. But what's the joint? Atlantic occipital, right? First class lever system. Edge too far forward, no longer first class, right? We're all first class citizens, so we want to make sure that that spine is now, that head is balanced on that. I think we're all first class. Okay. So remember we did that posterior glide? So this one was a good one to follow up with that, right? We tilt them into flexion. Now look up towards my fingers and just resist.
So this hand's pushing up.
Yeah. I'm rolling the ball towards his feet. Okay, and then look down towards your toes. So taking it further into capital flexion.
So he'll feel this at the back of his neck.
Yeah, it's opening up that suboccipital space.
Yeah.
What artery is back there that's feeding the visual cortex? Vertebral artery, right? Okay, and then look up towards my finger and just slightly push back, just slight like that.
So he's doing capital extension.
Capital extension, you got it, yeah.
And this stuff is all fine for somebody with rheumatoid,
Right. Yeah. Not for RAs if they got RA nodules up there, perhaps, right? Yeah.
No, no, no. No, thank you.
Okay, we'll just do one more like that. So, treating the upper cervical spine can have profound effects on the body. Some chiropractors will just treat just that joint and they solve all sorts of problems. I'm a bit of a skeptic about, oh, I got knee pain, well, we're gonna do the axial. But when you assess and you visually saw that there was a restriction, now you've got an indication to do this technique. And we've also seen, or compared that with our history, that suggested that there was, in your case, multiple MBA problems, right? So let's get you back up to sitting. And then we're just going to reassess from our sitting position because that's where we started, right? Okay, and then
Oh, yeah.
turn. Right? So much better.
Bless you.
It feels a lot better.
More even. How does it feel to you?
A lot better. Doesn't feel stuck.
Very simple, very easy to do for the therapist too, right? You're not working hard on this one. The other ones you're going to be working hard. So
How long do you
give
think it was
yourself
like
a
that?
break and do some
We're not
interviews.
users turns. What'd you say?
How long do you think it was like that?
Oh, it's like 7 years, 8 years.
And were you presenting with any headaches or any type of symptoms?
Used to, not anymore.
I would buy it.
Yeah, like I think 2
So,
years now.
yeah, good point and good questions because I didn't check his spinal mobility like I always do. Okay? Did you have any restrictions in your spine going to this side?
Yeah, I did.
Yeah. Can you put your glasses down? I'm just curious now. Yeah, 70 to 80 degrees. What do you think?
This looks like.
About the same.
Yeah.
Yeah. So you may have corrected a lot of stuff that's going
Check
on.
his reflexes now.